Good morning. We're here at the GHAPP conference in Washington, D.C. It's a pleasure to be with you. My name is Dr. Renee Pozza. I work as a nurse practitioner in the field of liver disease in Southern California GI and liver centers based out of San Diego, California. And I'm joined with my colleague here this morning, and I'm going to have her introduce herself.
Hi, my name is Allysa Saggese. I'm a nurse practitioner at Weill Cornell Medicine in Manhattan, and I work in hepatology and liver transplantation. And today we are discussing the question of, how do you think the new PBC therapy that was recently approved by the FDA will fit into the treatment landscape? So, what do you think, Renee?
Well, I think it's an exciting time in liver disease with several drugs being FDA approved this year. So that's always an exciting place to be when you have new options for patients. I think our PBC patients, as we know, are generally more on a female population. They have a disease that is more considered a rare disease and needs chronic management. And so this really gives us another tool in our toolbox as we try and manage the fatigue and pruritus, but ultimately the biochemical response and the reduction of ALT and the alk-phos.
Yeah, absolutely. I'm just excited to be able to offer something else. And what I find particularly exciting about this medicine is that it had very robust pruritus data. And we have not been able to say that to any other patients in the past with the other options available. We all know that sometimes with the initiation of treatment, once you first diagnose PBC, the pruritus may resolve or improve. But if we ever need a second line, the side effect has always been another kind of itch. Perhaps not the same as before, which is also a strange conversation to have, that your one kind of itch might go away, but another one might come up. But now we have one where we can say, actually, it may actually improve everything that you've been having, as well as having a very good biochemical response in the research trials as well. So I'm excited to be able to offer it to our patients. And I actually think what is great is that it can be in addition to a second-line therapy. So we start off with ursodeoxycholic, and we have had Ocaliva for a long time. And the new treatments can be actually in addition to Ocaliva instead of replacing it. So it can be a discussion and a choice if you feel that you want to add or replace.
Yeah, it's an exciting time to have this additional medication in our armamentarium. I do agree with you around the safety profile of the medication, not only in the ability to help with patients and their itch that's extremely annoying for patients, and so it's good to be able to offer an option that may improve that, as well as the additional safety parameters. The side effect profile looks really promising, as well as the drug-to-drug interactions and some of the things that you may need to consider with some of the other therapy options. I think this new medication has got a great safety profile.
Yeah, that's very true. And that's also a great feeling to be able to offer something to patients and not have to worry that much about the interactions and, like you said, safety. And I think that it is pointed that we are working towards this normalization of alk-phos. For a long time, we've only talked about the 1.67 times the upper limit of normal, which is also an interesting conversation to have with patients. You break out a calculator sometimes to explain it. But this, the new medicines coming up are really feeling that drive towards, we are going to work towards something even better than what we've been doing and what we've been having for our patients, so that we can prevent long-term complications and hopefully have very good evidence that we can prevent liver transplantation for them too.
It's a really good point. I think we don't always think about the risk of liver disease progression in these patients and how rapid it can occur. And while a lot of our patients do just fine for many years, controlled on medications, there is a group of patients that will advance. And so that underscores the importance of really trying to normalize the biochemical markers and reduce the alk-phos down into the normal range so we can halt progression of further disease.
Exactly. And one more thing that I have found promising about these medicines that have come out And the new medicine that we're talking about is that we can use it as a monotherapy if someone is intolerant of ursodeoxycholic or a non-responder. I actually have a patient who is taking it as monotherapy who had side effects on urso and called us about trying the new medicine and has so far done well. And that is one more thing in our toolbox that we can offer.
Yeah, I also have a patient that was not tolerating urso, and so that you can also consider either reducing the dose. So I have some patients that I just have a low dose urso, which also brings the other point of I think we really need to maximize the dose of urso. I don't know that we always remember to do that. The 13 to 15 milligrams per kilo. I separate it out into a BID dosing for patients, but maximizing that dose is important. But this second therapy option gives us the ability to either stop the urso or reduce the dose of urso if needed and still see good response with our patients.
Mm-hmm. And you bring up good points too. Urso to start with should be, comes up as 3 times a day. And I know that people are going to forget that middle of the day dose. So twice a day is how I do it as well. I have had some people doing it once a day. I think it is still as effective, but I go for twice a day as well. I check their weight at each visit. I make sure that they haven't changed their weight drastically enough that their dose needed to be changed too, especially if I'm not seeing the results that I am expecting on their labs. And as you said too, if we are having any gaps in the first line treatment, a second line that is effective as a monotherapy by itself will be that effective as well as a second line therapy in addition to the urso. And this also makes me think of that every time I talk about PBC or hear a talk about PBC, I'm reminded I really need to be better about checking about pruritus and fatigue with the patients. They may not recognize it as a symptom, and they may not realize to say to us, it's better, worse, or hasn't changed, or it's there. And so making sure we assess and specifically address this at every visit, I think is something that I'm reminded of every time I discuss this, and I want to remind others too.
Yeah, that's a really good point. Are you using any of the scales that were used in the trials, or do you have just questions as you're assessing pruritus?
I'm mostly asking questions. I think about those surveys all the time, and they're not easily accessible when I'm in a visit, when I'm remembering, oh, I should have that survey, the pruritus scale. Well, let me just ask. So I think if it was maybe more integrated into my EMR, it might be easier to access and pull up, maybe have a better record of it. Maybe if the patient could answer it ahead of time, there's a lot of ways it could improve. But no, I'm not using the surveys, even though I'm very, very aware of them.
Yeah, I do the same in my practice. I try and address it at every visit. And often if patients are suffering from it, they will disclose it to you before you even have to ask. But I haven't incorporated the scales in my practice as well.
Yeah, that's a good point, though. If they are having very bad symptoms, they're going to bring it up. But it's the more middling to they're used to it sort of patients that we might miss. And this also does bring me back to a prior thought I had with the medicine. We are talking about compliance and the correct dosing for urso that's twice a day. The good thing about the new medicines are they are once a day medicines. So we have a better chance of compliance with them too.
Great point. Well, I think this has been a great conversation. I hope this is helpful for those of you that are learning about the new options in PBC, and it's a very exciting time in liver disease. So thanks for listening to us.
Thank you.